please, our lovely producer. Yes, thank you for hitting record. Today's session, we're going to touch on a topic everyone has some connection to, whether you like it or not: social media. Social media can be used as a tool to help promote public health messaging, campaigns, and promotion of clinical and social services available for the community. Social media is also one of the most cost-effective distribution tools for healthcare information, expanding the spread of messaging across groups for free or at a nominal cost. Today, we have two really fabulous speakers touching on this topic and sharing insights directly from the field: Christina Rozek and Brooke Brown. Kristy will get us started today, and Brooke's presentation will follow. After both speakers have presented, we will open up the conversation for questions. Christina Rozek, she, her, is the brand and marketing manager of Planned Parenthood Metropolitan, Washington, D.C. She merges grassroots community marketing with data-driven, targeted digital campaigns to ensure that the DMV community knows where to go for non-judgmental, high-quality reproductive care and sexual education. Brooke Brown, our second presenter today, is a registered nurse working in clinical services in Harford County Health Department at the Edgewood location. Brooke has worked at the University of Maryland Medical Center in the heart surgery step-down unit, and then within the school-based health center clinics at Baltimore Medical System. When the pandemic hit and school shut down, Brooke shifted to begin her work at the Harford County Health Department. Please give a warm welcome to Kristy and Brooke. And Kristy, you can go ahead and start presenting.
Awesome. Thank you so much, Nina.
Thank you, Kristy.
Thank you. And hello, and thanks to everyone else for being here today. I know it's your lunch hour, so we really appreciate you being here. I know, as Nina mentioned, a lot of us operate on shoestring budgets, especially for marketing, which has only in the last few years made it into the must-have list for a lot of nonprofits. So today I'd like to share, as Nina was talking about, some free and low-cost marketing strategies, including social media, as well as some higher bang for your buck strategies if you do have a little bit of a budget that we can use. So I'm sure that we have a very broad range of folks joining us today on the call, and I think that this presentation can be applicable to you even if you're in clinical services, you're a medical person, you don't do any marketing, or if you do marketing, or if you're someone else and you're just curious about this. So I'd like to get things started with a little poll that Shanice is going to put up for us to collect a little more information about where everyone's at today in terms of their marketing knowledge or what sort of issues they're facing. So take a minute or two to answer this, and then we can look at the results together.
Please hold for a second. I'm having a little bit of tech issues with launching the poll.
Great, we're seeing some results rolling in. Wow. So it looks like a lot of people are facing issues with budget. Time is another big issue for most folks. I very much associate with both of these. Protocols, yeah, sometimes running things up the ladder in time can be really, really difficult. And lack of knowledge too, especially if you weren't trained as someone in marketing, you just came at this because it's, the whole team is working together to get everything done. Maybe you don't know what strategies you can use. So we'll cover a lot of this today. Looks like oh wow, 90% of people have responded. That's great. Okay, so I think unless there are a few other people who want to add their votes, I think we've gotten a really good idea of what sort of issues folks are facing. And I'm glad to hear it's budget, which is what we're mostly covering today. So thank you, Shanice, for putting up that poll. That was really helpful. Great. So to get started talking about this, there's some terms thrown around that I want to clear up first. So we hear the term social marketing all the time, and it's hard to know exactly what that means. How is that different from just normal marketing? And by the way, Shanice, I'm now on the second slide in case you want to forward to that. But social marketing, the thing that sets it apart is rather than selling a product, it aims to create positive social change. So that's why we're talking about it here. And with nonprofit marketing, we also hear that term, and that's doing something very similar. Instead of trying to gain customers, nonprofit marketing is aimed towards donors and volunteers. Next slide. To help set the stage for what I'll be discussing, I thought it would be helpful to show you something that marketing people use to divvy up all the different channels at our disposal to communicate to our audience. So this is the PESO model, which stands for paid, earned, shared, and owned media. Paid is exactly that. It's ads you put up on Facebook, in a magazine, or on a billboard. Earned media is what other outlets or organizations provide for free to you. So that typically covers news stories. Shared is mostly social media in all of its different channels. And owned covers the channels that you have control over, such as your website, blog, and email list. So if you're trying to think of new creative ways to get the word out about your message, it can be helpful to look back at the PESO model to get inspiration about any channels you might be missing. Next slide. So the question of the hour is, how do we do this on a budget? That's very difficult, but the good news is you don't actually have to have a big marketing budget. All you have to do is take all the opportunities given to you if you're part of a nonprofit social marketing team. You don't need to pour money into big advertising campaigns. So I'll show you a few ways how. Next slide. So first of all, most of the marketing you're going to be doing will involve creating graphic designs. And the issue with this, of course, is how do you get all these beautiful graphic designs without spending a ton of money? Because it's certainly a skill set to be a graphic designer, and they have pretty high hourly rates, as we all know. So Canva is a free online graphic design software. I used it to make this presentation. And it's been a game changer for me, and I'm sure for many other small marketing teams who could never afford a full-time graphic designer. It's very easy to learn how to use. You genuinely don't have to be an artist or have any artistic bone in your body. They have a ton of cute pre-made templates that you can just change the colors on and add your own content to. And the good news is that they offer free premium memberships for nonprofits. So if you fill out a simple application with some information about your mission and attach a document verifying your 501c3 status, you can get access forever to their premium membership. I highly recommend doing this if you haven't already. And if you don't want to do that, you can always just have a free account and it still works very well. Next slide, please. So something that you already know about, it's why we're here, is that free marketing is best done on social media. That's, the #1 strategy people often use, but this is easier said than done. So I just wanted to list a few key things here to help you maximize however much time you do have available to spend on social media. So the top thing to remember is to post consistently. Try to go for a couple times a week if possible. Also, different platforms have different audiences. So you should try to post things a little bit differently depending on where you are. For instance, Facebook tends to be older and Instagram is younger, except for Spanish-speaking audiences is what we've found, that there are a lot of young Spanish speakers on Facebook. If you're short on time and staff, another trick is to repost other people's work, but to do this in a way that everyone's happy with, you should reach out over direct message to the creator of the post and ask if you can use it and if they're comfortable with that. Most people are happy to get their work out there as long as it's attributed to them and they know about it. Getting a TikTok to take off can also be great, but a lot of effort. If you do this, you'll just want to make sure you don't plan your content too far in advance. It can sometimes feel stale. You want to be using whatever sounds or videos are trending that day on TikTok. And it's also a really good call, especially if you're starting out on there, to repost all of your TikTok videos to Instagram after the fact, because they often do a lot better on there than on TikTok. Another tip is just get a YouTube channel, even if you're not attending to it very much. YouTube has incredibly high traffic. People run across all sorts of things on there, and it will make it easier for you to then repost any videos that you have from events or speaker series or anything you've done in an inline format into your website, which will also include your increase people's interest in your website. If you're like us at Planned Parenthood and sometimes get really wild comments on your social media, you can change the settings in your Instagram and Facebook accounts so that anyone who comments using a specific keyword, something that would only really be used in a negative context, that comment will automatically be blocked and invisible on your channels without you having to do anything to it. So this really reduces your administrative load when managing a social media account. It takes a lot of hours off of your plate. Next slide. So another free but very important marketing thing to do is SEO. I'm sure you've heard all about this. It stands for search engine optimization. So this is when you type something into Google, say abortion clinics near me, and you get a list of results. You might wonder why some businesses come up first and some really reputable ones come up later, and you have to scroll down the page to find them. And this has to do with their SEO ranking, which Google determines by a variety of factors. The first of these factors is you can make your ranking a lot better by having as many reviews on Google and Yelp as possible. You'll want to encourage your patients or clients to leave reviews whenever they can. If they're leaving your center, hand them a little flyer, have something on the wall, put it on your social media, anywhere you can. Encourage them to leave reviews. And then you want to be responding to both the positive and negative reviews, ideally within a day or two. But this can be a lot of work. So a template of sample responses that you can pull these from is very helpful so that you don't have to be reinventing the wheel every time you respond. And sometimes people will see a business respond right after they post a review, and they will change their review and make their star rating higher because they feel attended to by your business and seen. So that can be really helpful. Another way to boost your SEO is by having a blog. And it doesn't even matter if people read your blog. It's the mere act of posting new web pages on your website on a regular basis that boosts your ranking and makes it easier for people to find your site. And the last big tip I want to share about this is finding ways to get links to your website posted in as many other places as you can. This means being part of local databases of businesses or being featured by local bloggers or getting into news articles. To do this, I would recommend pretending you're a customer of your own product or service and then doing a bunch of Google searches about it, which will show you any lists or databases that you might want to be part of, and then you can contact them. Next slide, please. Another way to get the word out about your work is through community partnerships. We work with a lot of other organizations in the community to refer patients for services that other organizations don't offer, and vice versa. But with that, we end up creating a lot of co-branded one-pagers and social media posts for both organizations to share, which can expand your patient base and grow trust and connectedness in your community. So a lot of organizations will have even a partnership page on their website where they'll post your logo and a link to your site if you're working with them. Just like you see on the right here, this list of partners that I pulled from one of our community partners. So this is a great place to find other potential folks you might want to work with just by scanning these lists. Conferences, you can also get discounts sometimes for attending conferences if you're a nonprofit. And even if you don't need to be there, it might be helpful to just get a free PSA in their ad, like in their booklet for the conference. And this is basically a free ad that you can have your services in because they want to encourage local folks to be in there. Next slide, please. So it's also good to be on the lookout for some local, low-cost, highly tailored options for advertising. For instance, if there's an email newsletter for a specific neighborhood or a local WhatsApp group where people just transmit information with a large community. I know we are connected to some of these. Or if there's a small community paper, consider advertising in those places. These aren't big name options and they don't have huge reach, but they don't have to be because if they're well tailored to your audience and they're based in your area and the type of folks you want to reach, that will do the trick. You don't have to have a big advertising platform and it's going to be a fraction of the cost. You can probably get these for free or maybe a couple $100s. And here's an example just of one of the local neighborhood newsletters that's pretty well known in Northeast DC, but this can be really cheap to advertise in. Next slide. If you do have a bit of a budget for social media advertising, one of your best bets is boosting on Facebook. This is completely adjustable and very easy to do. You just put up a normal organic post for something, and then it will have a little button on it that says boost your post. So you click on that and you can set basic parameters about the age and the type of audience you're looking for. And then you can spend however much you want, down to around $20 to boost a post for just a few days. You could spend, $1,000 if you wanted, but you can have very small targeted ads on here. One warning is don't boost a post if it's not already performing well, because adding more money to it and showing it to more people will not make them like it more. They'll just keep passing it up. So try to choose your most successful organic post. And another note is that it does take a couple days for these to be approved by Facebook, and they have some really stringent approval categories, especially when it comes to political advertising. I know that sometimes they don't accept abortion-related ads, which is an issue, of course, for us at Planned Parenthood. So just add a couple days for a buffer in case you need to change your ad, or in case it's an event that you really want to get the word out. And then Snapchat is also a pretty good strategy, though it isn't nearly as adjustable as Facebook boosting. You will need a Snapchat business account with a public profile that's linked to your ads account. So you have to get that set up. But once you're up and running, it's a great strategy for getting a lot of impressions. For those who don't know what impressions are, that just means the number of times your ad was shown to people. So tons of people end up seeing your ad, but in our experience, Facebook does have better audience targeting that ends up getting more people to actually click and make an appointment. So you may want to avoid Snapchat for that reason. The next slide, please. So if you do have a little bit of budget for digital marketing, the two biggest bang for your buck strategies are search engine marketing and display ads. Search engine marketing, SEM, is similar to SEO, but it's paid. So when you Google abortion appointments DC, and at the very top, there are the results that come up that have a tiny marking that say ad, you know that that's an SEM result, not SEO. This is a great method for attracting people who already know they want your service. They just have to know that you're out there. And you can put bids on different keywords, but keep in mind that the more popular the keyword is, or the more general it is, the more you'll end up bidding against other businesses to get a spot at the top of this ranking. So some other businesses, especially with places like us, who are politically contentious, may play dirty, and they will pay Google to show their ad when someone searches for your business by name. So that potentially could be like a crisis pregnancy center comes up when someone searches for Planned Parenthood near me. So there are a lot of strategies to SEM, but it can really pay off, and it's essential if you want to get customers, especially if you don't have much time to pour into the, SEO, like writing a blog and getting all those reviews. It can be a good strategy. Another is display ads. These are ads you see when you're reading on a website, like this example on the slide of some that came up on an online recipe for MailChimp. So you can see that they're little graphics, often GIFs, that are on a page in multiple different sizes. And these are ads, when these are ads for things that you searched for recently, like shoes that you looked at one time a week ago that seem to be creepily following you around everywhere you go, that's called retargeting. And helpful note, if you don't want this to happen to you as a consumer, you can turn off cookies or just search in private mode, and sites can't retarget you. Both SEM and display ads are run through Google Ads. You can create an account if you have a website for your business. It's pretty simple to set up, and then there are tons of tutorials to get you started with this. Next slide, please. Okay, so you get a big grant with $10,000 or more written in for marketing. Very excited about this, and you're interested in some splashy options. I'm guessing few people are going to want these, but I'll just put them out there in case you do. So local magazines are pretty good. You can usually advertise in their print or digital versions. Digital is a lot cheaper. Local radio, this is a high cost option, but you can get the word out if you found the right station or program to advertise on. It's always better to have a host of the show read your ad than to have something that you recorded that's piped in. It's much more effective. And you also want to have a really strong call to action for what you want your listeners to do when they hear this ad. If there's a national podcast you think would be perfect for you, you can buy an ad placement there that will only be played for listeners in your area. This is still a really high cost option, probably thousands of dollars for 1 week run, depending on the podcast. So a smaller local podcast would be better to start and a good place to hone your messaging. Public transportation is another option. You can do the inside or outside of buses. You can do bus stops, metro platforms, the inside of metro trains. But the problem with this is it's hard to track the exact impact of those ads. It is a great general brand awareness method though. And billboards are also an option. These are perhaps the most expensive. For those to be effective, you do have to have a good sense of where your target audience is driving. These are usually better for the suburbs if that's where you're placed. And again, similar to public transportation, these are great for general awareness, but they can't be tracked. Next slide. This is my last one. That's it. That was a whirlwind of information, but I would love to hear your questions. We do want to wait until the end after Brooke has presented to cover all the questions then, so please save them for after her presentation. Thank you so much, everyone.
Thank you so much, Kristy. That was an awesome presentation full of lots of great pieces of information and super helpful tips. For how we can like start marketing on our own and tap in to marketing for our organizations. Brooke, are you ready to get started with your presentation?
I am. Hello, everybody. Let me get this slideshow up. Can you see it?
Yes, we can see it.
All right, awesome. So I'm going to be focusing a little bit more on TikTok. At Harford County Health Department, where I work, we do have our own marketing and advertising team. However, my clinical team has sort of focused on TikTok because our goal was spreading education and awareness surrounding sexual health and marketing it to the younger crowd, as far as like getting information and trying to get more patients through our door for appointments as well. And just a side note, I will be showing a couple videos, but we did have to get all of these videos approved before we posted them by our advertising and marketing team and my supervisor. So I'm just really excited to share what has helped me get started with TikTok. And hopefully we can talk at the end and discuss ideas and answer questions and talk a little bit more about how you guys can get started on TikTok if that's what you're interested in doing. I recently have just started creating videos on TikTok. I actually I've been on TikTok for about 2 or 3 years without creating videos. So I've just kind of like been watching what everybody else is doing. So I am in no way like a professional creator, but I do have some experience and tips to share. So my objectives for today are to give you all a better understanding of how to use social marketing for your practice, specifically on TikTok. And to give you ideas, tools, and confidence that will help kickstart or improve your social media presence. So let's start with why. Why should we all even be on TikTok or any social media as healthcare providers? This is a really good opportunity for us to share resources with people who aren't even coming in for an appointment. For example, we have a prep video, and we even had a video that was featuring the I Want the Kit STD kit that you could get sent to your house for free to do some STD testing. So it was a good way to get those things out there. We even did a harm reduction video talking about Narcan. So that was a good way to get some harm reduction and spread the word about Narcan. As healthcare providers, we can also promote accurate information, squash misinformation, and any myths that are out there we can address directly, which is really great. Our STD fact and myth video actually got the most views, likes, and comments on it. And it's like really ironic. I'm going to show you at the end of, sort of towards the end of my slides, but I thought it was like the corniest one. I thought it wasn't going to do good at all, and it ended up doing the best because of all the information that was in it. People really loved interacting with the information that we put out there and asking questions. So that kind of boosts your post a little bit more when people are interacting, liking, and sharing it. So another reason we should be on here is that people more and more are turning to apps, the internet, and social media for health information. We all know everybody comes in and talks about what they found on Google immediately whenever you get a patient through your door. But even more so, people are turning to social media for health information. And I've even seen on Facebook, people are asking for recommendations for providers or, sometimes products. But even TikTok now, a lot of young people are looking for health information on TikTok. So this is also why it's really important. I'm also going to touch on this later, to use hashtags in your videos, because when people are searching for specific information, if one of their keywords that they are searching happens to be hashtagged in your video will result for them and they can see what you have to offer for that. So definitely going to touch on those hashtags later. And then my fourth point about why we should be on social media, answering questions. People start commenting sometimes with specific questions about something that you're talking about. And it's a good way to just clarify any information that they might be seeking. So for example, on our STD fact and myth video, somebody commented after we had posted about all STDs cannot be cured on their own. Somebody had said, well, my doctor said HPV can sometimes go away on its own. So we were able to comment and say, your doctor's correct. That's the one exception to the rule. So it was really cool to be able to interact with that person, because, I really didn't think that video was going to do well. It was really corny. So it was awesome that it got over 10,000 views. And then my fifth reason, which is not listed, but this was a real morale booster for our department. We started our TikTok videos at a time where we were kind of in a low and we needed a little TLC. It got us away from our desks, socializing with one another, laughing, and everybody after that was in the video, and even some of the people that weren't in the video kept coming up to me and asking me for updates on how it was doing. Did we get comments? Did we get likes? And then even I had people coming back up to me asking, when's the next video? So it was a really good booster for morale in the office. So for those of us that aren't trained or having an educational background in marketing or advertising, it can be intimidating to get on social platforms to market our practice, especially if we have never had or if we've never used certain platforms before. So I wanted to address some of these barriers that I have listed, because even I still struggled with this when I'm posting videos. I'm always questioning, is this curated to the audience that, I want to reach? Is this professional enough? Definitely don't want to violate HIPAA, but I feel like it's obvious to all of us health care providers not to violate HIPAA, but I'm going to share a couple examples where it wasn't exactly black or white when these people using social media actually did violate HIPAA. So first things first, you want to definitely keep it professional and mind your HIPAA. So keeping it professional, you want to avoid negative venting or joking about patient experiences, especially negative patient experiences. And the example that I have, it's referenced at the end of my slides. A North Carolina nurse got suspended actually for making humorous skits on TikTok and sharing negative patient experiences. Some of her viewers did not find it very funny because maybe they could have related to it. I'm not exactly sure why, but her facility actually saw that and they did not appreciate it either, asked her to take it down and suspended her. She did not get fired, probably because she didn't violate HIPAA, but it just wasn't a good representation for her organization. And then, like I said, keeping HIPAA in mind, we're not referencing specific patient information as well as specific visits. It's really tempting to try to, share experiences, but we have to make sure that there's nothing that we're sharing that could be linked back in any way to any specific patient or appointment. So the example that I have for this is actually in my screenshot on there. These doctors took in-surgery photos of patient body parts that were being removed without their permission, posted it on Instagram, and referenced the game that they play in the OR called Guess the Weight of the Body Part. So they did not directly reveal patient information, but they publicly displayed the body parts and where they worked on social media, and they posted it the same day. So people that follow them, that know them, could actually take the tidbits of information that they put on social media and potentially find out who that patient was. So even though it directly didn't seem like they were violating HIPAA, it was in fact a violation. And they shouldn't have posted the body parts anyways without the patient permission. Just not very tactful. And then not replying to patient comments, revealing information on review sites. This one might be a little bit obvious, but I did find a dental practice that had an associate reply to a Yelp review that a patient had left. And they, in their reply to it, revealed the patient's diagnosis and details regarding their visit because of how they were responding, which definitely was not appropriate for a public site. Everybody can see that and can see what the patient's diagnosis was. So now that we've got those things covered, and we're going to keep those in mind, we're going to download our TikTok app, create an account, set your preferences and privacy, which is all in the setup process once you download the app from the store, the app store. And then once you open it up, this first screenshot is actually what the home screen looks like, not necessarily this video that's showing. This just happened to be what popped up when I was taking the screenshot, but it's always going to pop up to your feed. So from here, you can scroll up and just start looking at videos that are suggested based on your preferences. And then in the top left, you can also click on following, and that's going to give you people that you are following, their videos or their most recent videos or most popular videos that are popping up, and you can scroll. So For You page is always based on what preferences you have set when you first set up the account. So you can hashtag For You page in your videos, and this is going to help it come across everybody's page, whether they're following you or not. And that's why it's important to always put For You page hashtag in your videos. So a little bit more about this first screenshot. The round thing with the picture on the right and the red plus symbol, that's the person's profile picture that made this video. If you clicked on that, it would take you to their profile picture to see more of their videos. If you click the white heart beneath it, that's liking the current video that you're on. You can comment by clicking the 3 dots in the white circle below that. And below that white circle with 3 dots is an arrow that you can use to share this video to other apps or other social media platforms as well. And then at the bottom, like I said, this is your home page, which is highlighted bottom left, home. Next to that is your friends. So if you click on that, you can search for people, add friends, and see who's following you and who you're following. The white plus in the square is to add your own videos or start recording a video on the app. The inbox is where you're going to find notifications, follow requests, as well as direct messages to you. And then profile is going to take you to your own profile. So then looking at screenshot 2, from screenshot 1, if we click the magnifying glass up in the top right corner, it's going to take you to screenshot 2. This is what it's going to look like when we go to search. So up at the very top under the search bar is what I've recently searched in this account. So in preparation for all of my videos that I did with Std Awareness Week, I searched a lot of that. I also searched Planned Parenthood when I was getting ready for this, so I could see the different accounts on there. And then suggested searches is based off of my preferences and what's kind of trending and popular right now on TikTok. So then if I type in Planned Parenthood and click on search, that takes you to screenshot 3. So now we're looking at different subcategories for searches. So you can see right before we go to the first Planned Parenthood account, there's different subcategories. So you have top, users, videos, sounds, live, and hashtags. So you can search top different subcategories for anything that you search. So I went to users because I wanted to find the Planned Parenthood account, and I clicked the red rectangular following button on the right. So I'm already following Planned Parenthood. Looks like that's like the general account. And then you can see other accounts that are there as well. So then screenshot 4, I just changed the subcategory to videos, and these are the top videos that pop up when I search for Planned Parenthood videos. So that's just a little bit about basics for searching when you first get the TikTok app. And it's a good idea when you first get the app, before you start posting videos, just to kind of explore and see what's out there, see what's trending and popular, what sounds you can use, and just kind of get some ideas and brainstorm. So then in this first screenshot on this slide, you can see that if we search the word sexual health, there are videos coming up with that hashtag, and we can see what people are posting about it. So that's exactly why it's important to use these hashtags. And the screenshot 2, it's showing you what it looks like when you click the white square from the home page to start posting your own video. So this is actually looking at my computer when it's not an actual picture that I've uploaded. It's just like a live screenshot of the camera. So you could click the big red button to start recording your own video through the app, or you can click on the right lower square that says upload to upload a pre-recorded video from your device. So those are the two kind of ways to get your videos onto TikTok. In screenshot 3, this is what it looks like when I have uploaded a video that I have pre-recorded into TikTok. So you have all these different editing tools on the side. So at the top right, AA, that's to add text to your video. Underneath it, you can add animations or stickers. Underneath that are effects, are transition effects. If you are putting multiple videos together, you can transition them with those effects moving into one another, or you can even reverse the video with this effect. And then you have filters under that. So that's kind of like working with the contrast, the brightness, and the lighting and shading of the video itself, the picture. CC is for captions. So if you want to turn your captions on, if there's a lot of talk in there, we can reach people who are hearing impaired or maybe don't have working sound on their device. And then privacy, you can actually change privacy video to video. So if there's a video you're uploading that you don't want to be seen by the public like your other videos, you can specifically make that video private. And then you have voiceover for commentary. If you don't want the original sound, there's a way to turn that off and do the voiceover for what comments you want. And then enhance allows you to use more filters. I'm sorry, this is the TikTok quick edit. So if you click it, TikTok just does like a quick filter enhancement for you. Kind of just like a quick way to make everything look better. And then at the top middle, you have added sound. I always recommend doing this one last after you finish everything else. So you can search for music, any type of sounds, trending sounds that are going on, and add it to your video. So I know that was a lot. Definitely want to be sharing your videos to other social accounts, just like Kristy said. That helps boost them, and sometimes they'll get more views on other accounts as well. So at Harford County Health Department, Std Awareness Week back in April was our startup for our TikTok. We had already had one created for the department, for the health department, but the person that was managing it had left a while back. So it just kind of was sitting, not doing anything. So I was like, can we just do something with it? Like, I think it would be really fun to get on there and make some videos. So we used Std Awareness Week to kind of get our start. When we were planning what we were doing for Std Awareness Week, my supervisor asked us if we could try to produce one video per day for the whole week, so 5 videos. And we actually ended up doing that plus 2 more videos. So we did a good job. We met our goal and went above and beyond. And like I said, our goal was to reach younger people with information about STDs and get more exposure to our page and kind of like revamp our page. So as a bonus, we tried to increase our following, our exposure, and our local exposure as well. So you can see this flyer that I did on the side here to the right. We did like a little contest to get more people locally on our account. So one of our things was like, how are we going to keep this contest local? So that's where the flyer comes in. We did not advertise the contest on TikTok because anybody around the world can see your videos on TikTok. So we advertised our TikTok account on the flyer within our community here. And that's where we mentioned how to enter for the gift card. So that's how we kept it. Just people in our community were able to enter the contest. We didn't want somebody in California seeing our video and winning the gift card. Like, no, we wanted Marylanders. So that's kind of how we kept that local. So I'm going to show you one of my favorite dance ones. And I'm showing you this one specifically because I want to tell you this one took us 10 minutes to record. After we all on our own learned the dance, which was relatively easy to learn, it took us 10 minutes to get the perfect shot for this video. Doesn't have to take a long time. Oh, whoops. Let me get this link. There we go. So that was really fun because we also made the shirts to go along with it. And everybody loved the shirts. And then this was the second video I'm going to show you was our really corny one that did really well. I did not think it was going to do very well. And then we got all of these likes and comments and shares, and it was awesome. So here's the STD factor myth video. So you can see everybody looks pretty excited to help me out there in the videos. It was really helpful to have people who were like enthusiastic and willing to help me. You know, I did get the people that didn't want to do it, which is fine. Like, I'm not going to force anybody to do something that they don't want to, but I was lucky to have enough people that did want to do it, and it made our videos awesome. So just some last quick tips to get started on TikTok. Make sure you're interacting with other users, commenting and replying to comments on your videos using popular sounds. That last video we did, that was definitely a trending sound at the time. Utilize your hashtags. Here's some helpful ones that we used. Sex ed for all, sexual health, STDs, For You page. Always want to use For You page. Did you know? Life advice, and learn on TikTok. This is one in particular that's trending right now because I think it's in a couple commercials for TikTok, but like I said, a lot of people are going to TikTok to learn things. Definitely go with the trends, any type of challenge, dance, sound, that's definitely going to be something people are looking for at the time, and your video will get a lot more views. We want to make sure you're getting quality shots for your videos, reducing clutter, making sure you have good lighting, and what you want to be the focus, try to get it as centered as possible where those people are going to be looking at their screens, and then try to get the most information for the least amount of time. People are going to stop scrolling only for eye-catching, witty, cute, and funny videos and that are quick flying. So patients, actually, we did have an outreach person get feedback from patients about our videos, and they said that they did like seeing the provider that they would see in an appointment in the video. They like seeing the facility in the video, and they wanted to see more diversity in the videos. So thank you so much for listening to my presentation. I'd love to discuss or answer any questions. If anybody has ideas they'd love to share, I'm all about collaborating.
Thank you so much, Brooke. That was so awesome. And I just loved seeing your team's TikToks that you made together. It really does look like a great, not only is it a great way to get that health information out there and to spread awareness with the public, but also a really nice way to connect with your coworkers and like do some team building.
Yep.
So really appreciated that you mentioned that and share those TikToks with us.
Yeah, thanks for watching.
We do have a couple really great questions in the chat.
Okay.
Deb asked, where do you get the list of WhatsApp and FB groups, and what is the typical cost of access to that? No, Kristy or Brooke, if you could speak to that.
Yeah, I can speak to that. I know I mentioned it in my presentation. So in terms of Facebook groups and WhatsApp groups, these are not a paid strategy. This is totally organic. For Facebook groups, I would act like you are one of your clients or patients and that you're searching for information, and then find those requests to be part of them and kind of monitor what is going on in there and the kinds of questions people are asking, concerns they're raising, and that will give you really, really good insight into your target audience. And then in terms of WhatsApp, we actually kind of networked our way into those. So we have sexual health educators who work in public schools in this area and community organizations. They realized that the parents of the kids they were teaching had a bunch of sexual health questions too. And they actually ended up being invited into WhatsApp groups to sort of be educators in these communities of hundreds of people in this area. So that's fantastic, but you have to kind of work your way into them. There's no way to really buy into that.
Thank you, Kristy. That's awesome, though. Another great question we have from Safia. Would you allow patients to record or take a video during a visit so they can post on social media? And if so, do you have a specific protocol in place regarding that? I think that was more for you, Brooke.
So I typically do not allow people to be on the phone when I'm in an appointment with them, but that's more so our clinic's policy. So I feel like you would definitely want to have a policy in place before doing something like that. I have had people come in and say, I'm a daily life blogger, and try to take a video. And I just have to say, unfortunately, we can't have anybody on the phone. And that's more of also like HIPAA, I believe, behind that. I don't think people realize sometimes when they're coming in, like how deep we're going to go into like their sexual history. And I don't, it's not necessarily assumed that we're allowed to share that information with the person on the phone just because they are on the phone. And that's how I always thought of it. So if you do allow recording, I would just definitely have a policy in place, because you never know what's going to happen.
No, that's true, Brooke. That's great, like best practice. Just always be sure. And you said that when you make your TikTok videos, you have to take them to get approved as well. So that's something that's also important to be aware of. Deb also asks, who approves the videos? Do you need to provide your PIO a script or sample images before you invest in making the videos? It's a great question.
So I actually would make and edit the videos all before getting them pre-approved, which was very risky. But because I had so many people collaborating with me, it was almost like, we know it's going to be approved because we all have put in the time and effort to make sure it's good content that's professional. So definitely, talk to the people that you're working with. And, if your advertising department or marketing department wants to approve it, get on the same page with them and like what your do's or don'ts, what's good and what's not going to be approved. Because I did have to show the entire video before I could post it.
That makes sense. Cool. Thanks. Anyone else in our attendee group have any other questions? You can feel free to pop off the chat. I mean, off the mute button and ask them directly. You don't have to put it in the chat. I was kind of wondering, some of these platforms, if you've never used them as just like a user, might seem super unfamiliar of where to start. What's like the best way to familiarize yourself? And I know like with TikTok, and there's like always this use of like trends or trending songs or trending memes. How do you stay on top of that, on top of the pulse as a marketer, and then also as someone who's creating TikToks?
So I just got on and just started looking and searching. You can literally search trending. You can search TikTok tutorials, editing tutorials specifically, like if you're trying to look how to clip videos or give it a certain effect. If you just search specifically what you want to see on TikTok, I'm sure you can find a video, because I've actually looked up tutorial videos on uploading, editing, because it's like you can do so much with the app that it's like, how do you even know? How do you even know what you can do with it? So I've done that before, where I've searched and just spending time looking at the popular videos or dances or what other healthcare providers have put out there is even helpful, because we our condom video, like we did not get that video, we did not get that idea to put condoms on produce ourselves. Like we saw another person doing that, we were like, oh, that would be so fun to do that. So you can get ideas just from TikTok.
Nice. And any advice for, I love the idea of how you really targeted like your outreach for followers with the gift card campaign. Any other suggestions from Kristy or Brooke about how to really make sure that you're getting that audience, accessing your audience of followers to like bring them in so they're, kind of keeping up with you?
I would say just even talking about it with your patients that are coming into the clinic, mentioning it to them. And, I had a couple of people, not everybody will want to be on TikTok or follow you or whatever, but some of my young people that followed us, if they start liking our videos, their friends are going to start seeing their videos. And so outreach, and anybody that walks into your clinic, tell them about what you have going on.
That's great advice. Deb also asks, does the staff share the responsibility to respond? And how do you fit this task in on top of everything else you do? It's a great question.
So I actually would go to the nurse practitioner and ask her for advice on how to respond. That way I knew it was the most medically accurate and tasteful, professional, not violating HIPAA. So because I was in charge of the account on my phone, nobody else really could respond to the comments except for the other person in advertising who has an account. She never asked me to respond. I just felt like when we had those ones that warranted a response, going to the nurse practitioner and saying, hey, can we come up with a response for this person? But I did not get the response approved.
Nice.
Oh, how do I fit that in on top of everything else I do? Well, right now we don't have a lot of commenters. When I said we got a lot of comments, I meant like a lot more than like what we usually get, which is almost none. So it was like maybe 15 comments, and most of them I just like to show that like I saw that you commented and I'm glad you commented. And then the ones that warranted a response were maybe like 2 or 3 of them.
Nice. Any other questions?
I have a question.
Yeah.
For reaching your community or staying in that community reach, what did you do to best get the groups that were socially active in the community? How did you figure out which groups to target?
Like in the TikTok community or like
Um,
in our local community?
In your local community, when you say you targeted, you did the TikTok, but then you targeted your local community with the flyer and brochure so that you kept it to the community you wanted to target.
Yeah, specifically Harford County. So we were going out, me and my team were going out to like libraries, gas stations, and like anywhere we could walk in and just hang a flyer. Nail salons, barber shops. There's an Advanced Auto. I went down and talked to the person and put my flyer in their window. Tattoo shops. And I realized not everybody can do outreach. We luckily had time to do that. And it also got us out and talking to people in the area too, which was good. But that's how we did it. We just went out and put the flyer out there, just in Harford County.
Nice. I love that you mentioned that. Great question about like where the different places that you would be kind of advertising your TikTok, not just on social media, but in real life.
Yeah.
Do we have any other questions before we close for today?
Just a big thank you. You touched on things I hadn't thought of and things that I didn't know or weren't aware. So thank you for stepping outside the box to attempt to get, not just your target audience, but to get awareness out there. Great job, ladies.
Yes, thank you both, Kristy and Brooke, for today. These presentations were awesome, and you really shared so much with us in just this hour's amount of time. And I think I feel inspired to get out there and start utilizing social media and TikTok more too. Thank you all for attending today's webinar. And in the next few days, all attendees will receive the meeting resources and a link to today's session's recording. Recordings will be housed on the Maryland Department of Health website. And please note that the evaluation link for today's session is in the chat box. So it would be awesome if you could complete that for us before Friday, August 5th. Certificate of attendance are opted in during registration for the sessions and will be sent out by the end of the week from our partners at the Healthy Teen Network. Please take care of yourselves, and thank you all so much for being part of the conversation today. Thank you.
Thank you.